about elimination here. So elimination, rate of elimination is how it is cleared. So clearance is, total clearance is however it is cleared. Is it cleared by kidney? Is it cleared by liver? Is it cleared by skin? Is it cleared by GI? Whatever it is. So the rate of clearance is equal to rate of elimination by plasma concentration, that is in liter per hour. Now this is very important. Rate of elimination can for a drug, rate of elimination you can divide in first order kinetics or zero order kinetics. First order kinetics is when rate of elimination is directly proportional to the plasma concentration of drug in the body. For example, see, if you give 1000 milligrams initially and then it reduces to this one. You give 1000 milligrams initially and then it reduces to 640 and then it reduces to 706. So the fraction, the amount of the fraction of the drug which is being eliminated is constant. The graph, if you plot it in a graph, it will be like this. So this is the, most of the drugs will follow first order kinetics because the fixed fraction of drug is being excreted. So what happens, clearance is equal to rate of elimination by plasma concentration, right? So clearance will be constant here because the rate of elimination is constant. Clearance also will be constant here. Also, rate of elimination is, as I told you, is directly proportional to the plasma concentration. Now, a few other drugs will follow zero order kinetics. That is, a fixed amount of drug will be eliminated. So if you give 1000 milligram initially, 800 will be excreted next, or then 600 will be excreted. So yeah, see, 1000, 800, 600, 400, but the percentage of how much it's being excreted is not the same. So there will be a linear graph here. And then if you put a time, at which the amount of drug is reduced 50% is called T half. The T half is the time at which the dose of the drug, whatever be the dose of the drug, even if it's at 800, what is the time required to reduce to 50%? Even if it's 600, what is the time required to reduce at 50%? That is called T half. Now T half, what is the use of T half? With the T half you can say what is the next time you should, second dose when you should give the drug. So the dosing interval is called as T half. So to simply put it as, dosing interval is called T half. T half has nothing to do with the concentration. It is only about the time. And now what are the drugs which follow first order kinetics are Wat-P, you can remember this as Wat-P, warfarin, alcohol and aspirin, theophylline, tolbutamide, phenytoin. All these drugs are there. And also so so this is the graph for first order kinetics. It's like this, and the zero order kinetics is like this. Now with the rest, with I told you, with T half you can estimate the dosing interval. With volume of distribution we can also with volume, along with volume of distribution we can also, why do we learn all this? Why do we learn T half? Why do we learn volume of distribution? Is because you can always you can always estimate when, at what timing you should give the drug, or what dose you should give the drug. Because with volume of distribution, as I told you earlier, it's very important to know the steady state concentration. Because see, when you give a drug orally, it keeps like this. At regular T halves, if you keep giving it, at one time it will reach a constant. This is steady state concentration, where administration is equal to elimination. Because you have to know the therapeutic range. If you exceed this, what happens? It will cause toxicity. Now for example, if a patient is in shock, this is for a normal patient who comes to OPD basis, or how do we give them. But if a patient is in shock, you have to reach the steady state concentration within seconds. So that is called loading dose. Loading dose is when you directly give this much amount of drug so that it can easily attain the steady state concentration. So all these things are interconnected, and all these things will have formulas, and I'll tell the formulas in the next video.